My name is Eline, and I am working at the 𝗘𝗶𝗶 for over 8 years, and I'm a movement therapist, which in Dutch is 𝗘𝗶𝗶 𝗕𝗿𝗂𝗏. I'm involved mainly with the Sint Maarten Center, and I'm active with the clients, basically. That's what my job entails mostly about. I'm also part of the Health and Fit Committee for quite a long time now, because this all started with my colleague, that sits right over there, Sebastian. In 2018 we started, and hold on a moment, I'm not doing this. Okay.
Nobody had a problem with
yeah, so that, as I said, with Sebastian in 2018. So what we're going to talk about today is the year overview of 2022. And we are also going over survey results of 2022, including the lessons we've learned, because we have run into some hiccups as well. So the physical activities that we have offered within the 𝗘𝗶𝗶 for our colleagues are quite a lot. Over 2022, we have done Pilates, yoga, boxing, salsa, and run training. So overall, 194 activities. There are people who are coming, so we approach the people on the island to come to the 𝗘𝗶𝗶 to give those sports activities. And as well, we are approaching colleagues where we know of that they can offer those sport activities as well. So it's people from outside of 𝗘𝗶𝗶 doing this for our colleagues, but also people where we know of, for example, a colleague who gives yoga training, she can then do some of those trainings also outside of working hours for the colleagues that we have. Besides that, we are offering our sports, we also give lectures. Again, that is people from outside who come in that we approach to give those lectures, but also our own colleagues have knowledge about certain topics presented on the sheet here that they can speak about very well. So it's outside that we look, but also in-house. Those lectures are very, very well attended, and so we offer them during working hours. So people are, except from, like they can go between either in the break, or they just tell the unit leader to go and then come back. So they are going to attend a lecture about budgeting, nutrition, mental health, etc., etc. What they learn there is, what we have noticed is that they always come back with a very, like, they have gained knowledge, and that's really what you want. So they come back with something additionally, then when they enter the room, they always come back with something that they have learned. And that also contributes to their overall well-being, in the sense of that they take care better of themselves. And that's at the end of the day where the whole Fit and Health Committee, what their goal is overall well-being. So besides sports, lectures as well. And then the health checks, which are an important one. So we have the people in-house, of course, nurses that can do, and the dietitians who can do these things on the sheet. This really gives an eye-opener to our colleagues how their own health is, because a lot of them, they go maybe lab once a year, and that's where it stays. And these checks for them is really like, okay, we have a baseline, and then we're gonna maybe do some training with you, and then we do a next check, and then maybe you're better or not. But it's an eye-opener for most people, and very important to have. Without this, you don't really have a start line for them. So they learn a lot about themselves when we do the health checks, for sure. Besides that, we have done walkathons, and these are very, very popular. So these can be done either on the island when they are organized. We, as the Health and Fit Committee, promote those events, and we go with a group of colleagues, or we organize themselves. So we are the ones then that are going into St. John's, and we order a nice shirt. They are often early in the morning. There's a healthy breakfast afterwards. So that's also something we have looked into. In 2022, we did 2 big events. One was the sports day. This was well attended, and it was in the Millie Wilson Park. So again, the Fit and Health Committee comes in together to organize this event, and it was very, very fun, and that was really something that was our focus, like to collaborate with each other as colleagues and to be active together. So besides that, we had the Sint Maarten Day really on the island, which is this Saturday again, and we again are attending with a team of the 𝗘𝗹𝗶𝗃. So as you saw on the previous slides, the running was the first, also a sport. So that is then something that we, a few months in advance, before then the November 11th relay on the island race, that we then trained for. So we're really gathering people together and we are saying like, hey, this is something that is good for you. Are you interested in running? Can you run at all? Anybody can attend. It's really a low-key, because a lot of people when they hear running, they're like, oh, I can't run, you know? Like, it's not something they are looking forward to do. They think about all the hills that we have on the island right away, but again, with training, you can get there. Like, it's not an easy, it's a shorter amount of distance race, but you need to train for it regardless. So it's coming together again as a team, 11 people. This Saturday you'll see us out there. So, of course, we do a survey afterward, like throughout the year, twice, and the results of that are that we need to, like, the people that, why they want to partake is one of the questions we ask, and these are that they want to eat healthier, they want to lose weight, they want to unlearn bad habits, and reduce the stress level. So, again, the 𝗘𝗹𝗶𝗃 committee focuses on well-being overall, and that's also what you see that people are interested in within our colleague group that we have. We also asked the question, why would you not come to these trainings that we offer, or lectures, or partake in events? And they gave us the feedback that they have either no time, they forget about it, or they are too tired. Because these, the sports sure are offered after working hours. So they will need to come in the morning with their clothes, and then after work right away they zoom over to go and do the sports activity that we offer for that week. Yeah, to prevent that, we all work in shifts, so we have to pick a day and time, which can work for the majority. That's always what we look at. And we also then try to make variety in the way we offer it. Maybe then the next month or the week after or the month after, we do in the morning hours we offer it instead of then after work for 4:15. Some people like sport in the morning, some like sport in the evening, so it's always that you never can please anybody. It will always be like, yeah, you have maybe a large group this week and the week after a little bit less. That's always how it will be. So the lessons we've learned over the years, so since 2018, but this is a review of 2022, but overall this is what we always have seen. It will always come back like in this matter. So the sport activities, we have small peaks in attendance in the start, but rapidly they decline after the hype is over. So people are very enthusiastic when it starts, and then a few weeks later you can see the attendance dropping down. So you don't just stop offering it, because a small group that you have, you are making those people happy. And again, the Fit and Health Committee is focusing on the overall well-being. So if you can make a small group happy, that's what you need to take with you. Sorry. So we decided for this year that in 2023 we would scale down to the most popular sports, just to give people like just the two options and see if then they would attend it even more. So these are for, in our case right now, Pilates and yoga that we offer most. The lectures are always good attended, so they will keep on being offered throughout the year. Once, maybe even in some months, we offer twice a month a lecture. The events, they are often well attended, but they need promotion. Like, we need to keep talking about it and keep promoting it. And that's even sometimes coming then from other colleagues to each other, or maybe from unit leaders within the 𝗘𝗹𝗶𝗃, but also from us. And you can see the moment that a colleague is not really interested, but hears it often, and sees flyers, and hears the promotion, and sees pictures from the years before, they will get enthusiastic. So it might take some time, but they will get it. That's what we really have done. Any questions about the Fit and Health Committee?